Hey, this is Dr. Walker. Welcome back to the channel, denwalker.com. So I had a question this past week about how a person can increase their calcium levels without calcium supplement, because I said online that I do not condone or like folks taking calcium carbonate pills for increasing their calcium blood levels. So that's what I said, and so folks were asking essentially, how then do you increase your calcium levels without the supplementation? So first of all, there are lots and lots of foods that have high calcium levels: spinach, kale, any of those fatty fish, so sardines and salmon and tuna, right? Figs, for example, all have pretty decent levels of calcium. So that's the first part. Now, calcium from the gut needs a lot of help. Now, the calcium carbonate pill that I talked about before, most of that pill, when you take it, most of it stays in your system and goes out into your stool. So about 20% of that calcium is actually absorbed into your system. Now, some of those calcium carbonate pills come with D3, but you need more than just D3. So D3 and calcium carbonate by itself will, yes, get that 20%-ish from your gut into your blood, but then that's not it. So that calcium that's now in your blood, unless it has some other things associated with it, will just then get stuck in your blood vessels, causing atherosclerotic disease and coronary artery disease and in your soft tissues and all those things. So that's not ideal. So what you really need is natural things, natural foods, as I said before, like any of those fatty fish or spinach or kale, those kind of foods first, to get the calcium from those foods, and then put those in your blood. Now, when you take those, eat those foods, which I would suggest and recommend to folks, you also need a couple of other things to get the calcium where it needs to go. Okay, so now you need to have D3. So now you've eaten your food, now you have D3 that you're taking. And again, take your D3, for example, in the morning with some fatty food. If you're intermittent fasting, you can take it with a little bit of MCT oil. That should not break your intermittent fast. And you can add that to your black tea or water. So MCT oil with a bit of water or black tea, whatever, any of those things, you can take your D3 and your K2 with, because those are fat soluble vitamins. So again, back to the D3. D3 is a thing that's going to pull that calcium from your bowel that you've eaten from your spinach and your kale, right, and put that into your blood. Now, once it's in your blood, right, just like the calcium carbonate, unless you have another way of mobilizing it from the blood, it'll do the same thing calcium carbonate will do, which is get it stuck in your blood vessels and your tissues and so forth. Again, that's not the goal of what you're trying to get done. So now you need something else. You need some K2. Now, K2 comes in many different forms. You can get K2 nattokinase in any of those fermented cheese, for example. You can get it in K2 dairy. That's the letter K and the number 2. K2 dairy products, also fermented foods like sauerkraut, can all give you decent levels of K2. Now, back to the D3 for a second. D3, some articles will tell you that you need to take about 5,000 units of D3, 5 to 10,000 units of D3, and then in a couple of months or so, get your levels checked. Now, ideally for people, I would suggest getting your levels to a high normal level. High normal meaning about 80 nanograms per milliliter is what I would suggest, is what I do for myself. Get your levels that high, because again, most, if not all, of your body functioning systems utilize D3. So you need to maximize that as best as you can. So maximize your D3. They say 5 to 10,000 units of D3, and then get levels checked in 3 months. The K2 now. So again, D3 takes it from your gut, puts it into your blood. K2 is going to help that calcium go from the blood into where it needs to go. K2 also pulls the calcium out of your soft tissues and your vessels and so forth, and puts it into your blood. So it takes the calcium from the blood or from the tissues and puts that into your bone where you need to have it, right? So two things, again, you need with your good foods, again, K2 and D3 help significantly. Now, an article I read probably 5 or 6 years ago essentially said that if your D3 levels have been maximized, so let's say you're taking your 5,000 units or your 10,000 units of D3, if you do not have adequate calcium to activate those D3 receptors, it's a futile process. So you need also magnesium to help to activate those D3 receptors for them to become active for you. So you need all three of those things. So you need the good foods we talked about before, then you need D3 and K2 and magnesium. Now, magnesium for most men in the US, based on the RDA standards, is about 400 milligrams for men, and then for women it's about 300 milligrams per day for those folks. Now, there's a whole lot, and I've listed that quite a bit online in terms of the different types of magnesium. And actually, I put that in the bottom of this link as well. The different types of magnesium you can take. The types you take is really based on what you're trying to maximize, right? So some people will take threonate if they want to work on things that are sort of being focused or more focused, essentially. A lot of people take glycinate because it's sort of one of those ones that works for a lot of different things and a lot of folks. So look at that list again that I'll put in the bottom of this thing, and you figure out which one of those magnesium you want to sort of take based on what you're trying to supplement up with, right? But for me, it's a glycinate is what I like to use. But again, and you can take that sort of anytime you want. So the magnesium you can take either in the morning or at night. A lot of people take magnesium for sleep aid. Sleep aid is essentially, or they'll take it for both. Some people would split the dose and take half in the morning and then half towards the end of the day, about an hour before you go to bed, to help you with sleep. But the type of magnesium, again, you take really, as long as you're trying to work on some stuff, then take the one that you like to take, and it works to help to activate those D3 receptors again. But important that you just take it sort of the same time every day, whether it be in the morning. If you take it morning and night, then do that. If you take it at night, then do that. If you take it just in the morning, then do that as well. So it doesn't make a difference. What you need to work on is getting the serum level of your magnesium to be standardized. So whatever that looks like for the individual. So again, lastly, all of those things are sort of important. So you need the good foods that we talked about before, the D3, the K2, the magnesium. All of those things are important because calcium carbonate, if you use it just by itself with maybe just D3, you run the risk of getting severe coronary artery disease, atherosclerotic disease. You run the risk of strokes, and all those things you run the risk of if you take the calcium sort of without the other parts that needs to get the calcium where it needs to go, which is ideally, for example, in your bone. And sort of the same thing with people with osteoporosis, right? If you have osteoporosis, I'm never going to suggest to you to take Fosamax or Boniva or any of those things. You really just need to be able to maximize your calcium levels by the foods that you eat and then those supplements that we talked about. Now, obviously, if you can't get outside in most days that's sunny outside between 10 a.m. and 3 p.m., go about 20 minutes with most of your clothes off. Again, I'm not telling you to do that, but if you're trying to get your D3 just from sun exposure, you need sort of that kind of thing for about 20 minutes, but most of your body has to be sort of exposed to the sun rays, essentially, on a very warm day, sunshiny day, between 10 a.m. and 3 p.m., any of those times, just to get your just to get your D3 levels without supplement, right? But most of us, if you're in a building or you're a school teacher, or you're in a hospital somewhere, 10 a.m. to 3 p.m., those are prime time to be working, not outside. And so D3 supplement is what I use because I know I do not have enough exposure outside to get me the adequate levels that I need. But if you can get it done yourself, do that. If you're not going to do the supplement, then I would still suggest that you get your levels checked. And I promise you, if you've not been taking supplements before, you're going to be one of those individuals who are going to be deficient down in the 20 or 25 or even 30 nanograms per milliliter is what you're going to have in terms of if you've not supplemented before. But ideally, I suggest people to get it definitely above 60 to 80 thereabouts, and sort of getting your concentration of D3 as best as you can. So, and again, it does a lot of good for a lot of people. So you should be supplementing yourself unless you're outside getting the exposure that you need for your D3 levels to rise. Anyway, that's my discussion today. Thanks for listening, Dr. Walker.